And they're always in these rooms. And, you know, I see them in the rooms where the cameras are and where the cameras are not. And they are always fighting for the people of Texas. They are leaders for Texas, and they are national leaders. And they represent the voice of all people so well. So thank you all. Thank you, thank you. So listen, today is the last day of early voting in Texas, and you all have been doing your thing. What did I hear? Was it 9 million people have voted so far? Early voting in Texas, 9 million? Now we know this is no time to let up on the pedal though, right? So I know people sent me pictures of standing in line at midnight this morning, I guess, last night, waiting to vote. There was a line. People are committed. And so today is the last day of early voting in Texas. We want to make sure we see it through. And then let's make sure on Election Day, everybody we know has made sure that their voice, their powerful voice, is represented in this election through their vote. Because there is so much at stake and so many reasons to vote. You know, just think about it. Right now in our country, we are in the middle of at least 4 obvious crises, right? There's the crisis that is a public health crisis that has caused over 215, I think now over 220,000 people to die in just the last several months. And the tragedy of it is so many, because of the nature of this pandemic, spent their last hours on earth without even the benefit of holding the hand and touching someone they love. Maybe communicating through a video, but without the warmth of the family around them. 8.5 million, almost 9 million people have contracted this virus with untold long-term consequences. You know, doctors are talking about things like lung scarring. It will, by the way, at this point, most likely qualify as a pre-existing condition, which means on top of the numbers that we know, the disproportionate numbers in terms of African Americans and Latinos for high blood pressure and diabetes, we're now looking at this. Let's look at the racial disparities on this virus. African Americans and Latinos are 3 times as likely to contract the disease and twice as likely to die from it. The tragedy of the loss of human life. You know, I've been referring to this as one of the greatest mass casualty events that we've experienced since World War II. The tragedy of it. And here's why I bring it up, guys. It didn't have to be this bad. It didn't have to be this bad. Just think about it. Thanks to a fellow by the name of Bob Woodward, we know that the President of the United States was informed back on January 28th about the seriousness of this virus, informed that it is 5 times as likely to kill people as the flu, was informed that it would hurt people of every age, was informed that it is airborne. And he sat on that information. He called it a hoax. He suggested that on his ledger of who people are, you're on one side of his ledger if you wear a mask, you're on the other side of his ledger if you don't. And can you imagine, as parents, as teachers, as small business owners, what you might have done if on January 28th you had known what the President of the United States had known? What you might have done to prepare, knowing that even before this pandemic, far too many Americans were working 2 and 3 jobs to try and pay the rent and put food on the table. And by the way, in Joe Biden and my America, nobody should work more than 1 job to have to put food on the table and pay the rent. But what folks might have done to prepare, knowing that most working families don't have even $1,000 in savings. What people might have done to prepare, small business owners. workers. Because you see, still, even before this pandemic, which has been highlighted, we have a country that has not made it a national priority for working people to have paid sick leave and paid family leave. That will change in a Biden-Harris administration. But what people might have done to prepare teachers and students and parents around the fact that their children are going to miss so much of these critical days of their education. What people might have done to prepare, to just simply buy a couple extra rolls of toilet paper. But they sat on this information, and they didn't tell anybody. And now we are looking at a situation where in the midst of a public health pandemic, you also have a situation where we have a president who, while we are seeing spikes around our country, talking about we've turned the corner, continuing to mislead the American people. So there are clear choices in this election. Because on the one hand, you have Joe Biden, who together with President Barack Obama created Obamacare, which brought health care to over 20 million people and protected people with pre-existing conditions and understood that health care and access to health care should be a right and not just a privilege of those who can afford it. Joe Biden, who says we will expand on the Affordable Care Act, Obamacare, we will extend protections, we will bring down the cost of prescription drugs, we will bring down the cost of premiums, we will lower Medicare eligibility to age 60, we will expand health care, understanding the body doesn't just start from the neck down, it includes the neck up, and we need to expand mental health care. Clear choices. Because you see, on the other hand, you have Donald Trump, who together with his boy, Bill Barr, are in the United States Supreme Court right now trying to sue to get rid of the Affordable Care Act, which again brought health care to so many people. Here in Texas, we're looking at 10 million Texans who have pre-existing conditions. If they are successful with that lawsuit, all of the folks who have over 20 million people are likely to lose their protections. And we now have almost 9 million people who have new pre-existing conditions called COVID. There are clear choices in this election. Because of this pandemic, the worsening of the wealth gap in America has been such that over 30 million people in just the last several months had to file for unemployment insurance.